Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. Nik Nikam, a cardiologist who has been in practice for more than 40 years here in the Houston area. Today, we're going to look at the low dose aspirin and does this prevent heart disease? At least that was the consensus. Until about a couple of years ago. The consensus have changed based on the new recent studies, and we're going to look at those studies. And we are also going to look at how aspirin prevents heart disease and where does it stand today as we speak in 2022. So let us begin with the feature presentation. Cardiovascular disease is one of the leading causes of death here in the United States. 1 out of every 4 deaths is related to cardiovascular events, be it heart attack, stroke, or vascular disease. An estimated 605,000 people have a first heart attack during each year, and in the same period, approximately 610,000 people have stroke, all of which are related to the atherosclerosis or hardening of the arteries that leads to blockage of a tissue leading to a heart attack or stroke. Since blood clot formation is an integral part of this plaque buildup in the arteries that leads to blockage and heart attack and strokes, aspirin has been used for the longest period of time, for decades, to prevent heart disease among those people who already have heart disease or stroke, and also to prevent heart disease in people who did not have any heart disease or stroke to begin with. So the second part, which I told you, was called the primary prevention of heart disease. That is preventing heart disease in people who already don't have heart disease, versus secondary prevention, and that is those people who already have heart disease. We are trying to minimize further risk factors by using aspirin. Aspirin, during my 40 years of practice, I probably have given out more aspirin than any other cardiovascular medicine. We used to have stacks and stacks of aspirins stored in our drug department, and in fact every month we used to get a supply of these boxes to be given away. It was based on the fact that aspirin reduces the risk of heart attacks, strokes, and overall cardiovascular mortality. This is based on all the studies, which we're going to look at it in a minute. However, the United States Preventive Services Task Force reported on April 22nd, 2022, a review of all the most recent available data and came up with a recommendation that is quite different from the recommendations we had in 2016 and beyond. And here is a roadmap between 1985 to 2020 as to all the different studies that were used in determining whether aspirin as a primary prevention of heart disease and strokes was valid. So based on these studies, it was felt that aspirin is useful in the population between 40 and 70 or 85 in preventing primary heart disease and also reducing secondary cardiovascular events. However, the more recent studies like Aspire, Arrive, Ascend, which were reported along with the JAD2 in 2019, the concept has changed, and let us look at as what has changed. Before I go into this study, I want to explain to you what is the role of aspirin in heart attack and strokes. How does aspirin prevent heart attack and strokes? So let's take a look at that. As you know, there is buildup of cholesterol or plaque streaks, which begins at age 20 or 30, and it gradually builds over years. But throughout the process, there is inflammation, breakdown of tissues, which leads to activation of the platelets that causes the clotting that leads to sticking of these platelets and forming like a cement in that atherosclerotic plaque. As a result, these plaques can grow. So preventing the platelets from sticking to each other is one of the main crux of reducing the cardiovascular events. At least that's the concept, and that's where the aspirin comes into play. Aspirin is one of the agents that increases the stickiness. Aspirin blocks the stickiness of the platelets so they don't form a clot so easily. And here is an example of a platelet which is activated by thromboxane A2. And this is derived from arachidonic acid. Aspirin, which is a COX-1 inhibitor, blocks this pathway, thus blocking the production of thromboxane A2, thus making these platelets inactive. So they can't stick to each other. That is one of the most important functions of aspirin, and the effect of aspirin on this COX-1 inhibitor is permanent. So once you give aspirin, whatever the platelets are in your body, they totally are kind of affected by this for the rest of their duration, which is 5 to 6 days. Until you develop new platelets, that's why they say if you are taking aspirin, hold it for 4 to 5 days before you go for any surgical procedures. So that is a concept behind what, how, and why aspirin acts. Okay, the next factor that we need to take into account is the risk factors. As we get older, we develop more risk factors like obesity, which is just a part and parcel of growing older or richer, or whatever you want to call it. Smoking, number one risk factor for heart disease, just behind cholesterol. Hypertension is an independent risk factor, and lack of physical activity. Diabetes is an independent risk factor for heart disease, and poor diet with high saturated fats, cholesterol, and butter. All of these act as risk factors along with age, which is not mentioned here. So the more risk factors you have, the higher the chances of getting heart disease, and that's where you think the aspirin would come in to reduce your chances of getting cardiovascular events. Anyway, how much aspirin do you have to take to prevent one heart attack? If you look at here, 357 people had to take aspirin in order to reduce one heart attack. Similarly, 500 people had to take aspirin to reduce one stroke. And it goes on like a transient stroke. And major cardiovascular events, 263. But aspirin is not a benign medicine. Aspirin can lead to bleeding, which can make things worse. As a matter of fact, while it takes 357 people to prevent one heart attack, it takes only 222 people to take aspirin to experience a major bleeding. And look at this. If 1,000 people are taking aspirin, there's a chance that one of them could bleed in the brain, leading to a stroke. So the aspirin is like a double-edged sword. It is beneficial, but also has some risk. But the risk is very small. Nonetheless, it is there. That's why we have to determine, is this aspirin really good for you, and is this going to help you to reduce cardiovascular risk without increasing bleeding complications? Anyway, the way you find out about your risk factor is they calculate it on the basis of what is your 10-year risk of having cardiovascular events. Is it greater than 10%? Is it greater than 20% or greater than 30%? And that you can find out by visiting the American College of Cardiology, American Heart Association website. Just Google this one and you can copy this title here. And here you plug in your age, your sex, your blood pressure, your cholesterol level, your weight, all of this, and it will spit out your 10-year risk of having a cardiovascular events. If your risk is greater than 10, then the question of aspirin comes into play. If you are low risk, then you probably don't need aspirin to begin with. So keep that 10-year 10% risk in your mind. Okay, the USPSTF, which I just mentioned to you earlier, they looked at 13 randomized controlled trials involving 161,680 participants, and they came up with these conclusions. They said low dose aspirin in the population between 40 and 59 who have a greater than 10% risk over 10 years may get some benefit from aspirin. This is quite different from the 2016 recommendation, which said people between ages 50 to 59 with greater than 10% risk benefited from aspirin. But the benefit has been found to be marginal, not substantial, and the age for cutoff of aspirin used to be 70 in 2016, but now it has been said that beyond age 60, there is no evidence that aspirin prevents major cardiovascular events in a primary prevention setup. That means if you didn't have a heart or vascular problem and you are taking aspirin to prevent that, the chances are the benefits are very minimal. And the next thing is the fatal myocardial infarction or a heart attack that leads to death or a stroke that leads to death. There was no significant difference in the treated group versus the non-treated group. So in other words, aspirin has a modest benefit in the population 40 to 59 who have more than 10% risk of having heart disease over 10 years, but it does not decrease the mortality. A word about secondary prevention. Let's say you have been let's say you've been diagnosed to have heart disease or a stroke, and taking aspirin for that along with antiplatelet agents like Plavix or anything else, that's a totally different ballgame altogether. So we are not even talking about that population. This is primarily related to primary prevention of heart disease among the high-risk population. So ladies and gentlemen, the conclusion is initiating aspirin use for primary prevention of cardiovascular diseases in adults over age 60 has shown no benefit. Ladies and gentlemen, in conclusion, here's the chart from 2016 recommendations and 2019 recommendations. So you can just memorize this one if you're taking your board exams. Thank you so much for watching this presentation. I am Dr. Nik Nikam, a cardiologist from Houston, Texas. And please do subscribe to our YouTube channel, and I will see you in the next presentation. Thank you.